Histology of uterus. So this is the slide of uterus. First, let us look at the basic structure of uterus. In proliferative phase, the uterus contains basically two layers. This is the myometrium and this is the endometrium. Myometrium mainly consists of the smooth muscles with the blood vessels intervening. In the endometrium, it is lined by the columnar epithelium. In lamina propria, there are few glands which are not coiled, but the arteries are coiled. If you look at the uterus in the secretory phase, we can see there is functionalis layer, basalis, and myometrium. Myometrium again contains the smooth muscle with the blood vessels intervening. Then this basalis layer, in which there are uterine glands which are tortuous. Coming back to the slide, when we focused uterus on 10x, we can see that these are the uterine glands and this is the endometrium lining, which is the simple columnar epithelium, and we can very well appreciate these uterine glands which are not tortuous. So we can say that this uterus is in the proliferative phase. When we focused it on 40x, we can see the vessels. So these are the tortuous blood vessels. Identification points for uterus in the proliferative phase. The wall of the uterus consists of a mucous membrane called endometrium. So this is the endometrium. A very thick layer of myometrium. This is myometrium. The thickness of the muscle helps to identify the uterus easily. The endometrium has a lining of columnar epithelium that rests on the stroma of connective tissue. So this is the lining of the columnar epithelium. Numerous tubular uterine glands dips in the stroma. So these are the uterine glands that dips into the stroma. The appearance of the endometrium varies considerably depending upon the phase of the menstrual cycle. Endometrium is thin and progressively increases in thickness. The uterine glands are straight tubular in this phase. So you can see these are the straight uterine glands. Identification points of the secretory phase. In secretory phase, the thickness of the endometrium is much increased. So you can clearly see this much is the thickness of endometrium, and in the previous slide the thickness was very short as compared to this. The uterine glands elongate, become dilated and tortuous, as a result of which they have sawtooth margins in section. So you can see that the uterine glands are tortuous here. Blood vessels extend in the upper portion of the endometrium. So these all are the blood vessels that has been extended into the upper portion because they need to be shed off. In this phase, the appearance of the endometrium becomes so distinctive that the uterus cannot be confused with any other organ. So this was all about uterus. Thank you for watching.